got several guests with us today to discuss the similarities and differences between hospice care and palliative care. So let's start with Dr. Robert Cella, who's Phoebe's medical director for palliative care. What's an easy to understand way to describe what palliative care is?
Well, I'll describe it as a coin, two sides. On one side we have palliative care, and on that side we're still treating serious illness. And as time goes on, the serious illness may be harder and harder to treat and get to the point where symptoms aren't being managed by current therapy. On the other side of the coin is hospice. On hospice, it's just comfort measures. That's where we've not been able to treat the patient anymore for a curative effect, but want to make them comfortable and accept where they are at that moment in time. Palliative care and hospice, that's why I say they cover both sides, two sides of the same coin.
So as a palliative care physician, what are some of the typical kinds of patients that you would see here in the hospital?
Anyone with life-limiting or life-altering illnesses. For example, advanced COPD, heart disease, dementia. We also treat families as a whole picture. We treat this not just the medical side, but the spiritual and psychological aspects. We have counselors and diverse support staff, including chaplains and respected people's individual faith.
Jennifer Stevens is here as well. She's the executive director for Phoebe Hospice. So talk to us a little bit about the specifics of hospice care.
Great, thanks, Ben. So like Dr. Cella was saying, hospice is a type of palliative care. So if you think of a pie, hospice would be a slice of the palliative care pie. One of the main differences, or two of the main differences actually, is that hospice is a 6-month or less prognosis, and it does not occur at the same time as curative treatment. Whereas palliative care can happen simultaneously with aggressive treatment and also with a much longer prognosis.
Now at Phoebe, we offer hospice care at Phoebe Sumter and here in Albany.
That's correct.
The Wilson Hospice House is an amazing facility.
Yes.
Tell us a little bit about that.
Sure.
And the types of services that you offer.
Sure. So we do cover outpatient and inpatient services at Phoebe Hospice and at Phoebe Sumter Hospice. Outpatient care takes place in a patient's home where our entire team goes in and provides physical, spiritual, and emotional care to the patient and their family. And then we offer respite care at Wilson Hospice House and general inpatient level of care. Respite care is a 5-night stay at the Wilson Hospice House where patients come in, we give their caregivers a break. They stay with us, we provide all of their care and encourage their families to rest, recuperate, and then the patient will return to their home after the 5-night stay. And the general inpatient level of care is for patients who are experiencing uncontrolled symptoms. So we do a lot of pain control there, a lot of care for respiratory distress, as well as agitation.
Susan Brooks is our palliative care manager here at Phoebe Putney Memorial Hospital. Other than that direct clinical palliative care, what other kind of palliative care services do we offer to patients and their families?
Thank you, Ben. Great question. So in addition to Dr. Cella, who is our medical director, we also have 2 advanced nurse practitioners, and their role with Dr. Cella is that medical management of the pain and the symptoms that come with a chronic illness or injury or the treatment of. And then in addition to our team, we have a licensed counselor, a licensed clinical social worker, and a chaplain. And their role is to provide that emotional and spiritual support that comes with having to make difficult decisions around the patient's treatment, goals of care discussion. Our counselors are able to connect our patients and their families to community resources and programs so that they will have what they need upon discharge. And then our chaplain is able to connect them to their spiritual or their faith community while they're here in the hospital or upon discharge. We're also able to assist with advanced directive care planning And even though we only see patients while they're here in the hospital, our team is still available to them upon discharge via phone.
And one last question to any or all of you. What really is the importance of hospice and palliative care? Why is it so important that we provide these services to our patients and their families?
Well, Ben, as you know, with the advancement of medical care, people are living longer. And people who are diagnosed with a serious illness and or injury can still live multiple years. So our focus as palliative care is to give them that support around their pain and their symptoms, provide them with that emotional and spiritual support so that they can continue to live the life, the quality life that they would want to live for however many years they have. And that's actually been shown that it extends their life.
I think for hospice, we are able to care for patients in their own home where most people want to die, surrounded by friends and family. It's a wraparound service. We're not just taking care of the patient, we're also taking care of their family and friends.
And they've also found that people who are more better adjusted and at peace with themselves do better with pain management and symptom control. From personal experience with my own mom, when she passed from liver cancer, she was positive for 20 years. They kept on telling her what was going on. She never lost a beat. It was always there for me. And every patient, I hope to have that experience with holding optimism.
Thank you so much to all three of you for what you do and sharing your expertise with us today. And if you'd like more information about hospice or palliative care services at Phoebe, you can call the numbers on your screen.